Good evening. In March of 2020, the novel coronavirus known as COVID-19 arrived in the tri-state region. Now, 1 year later, we look back on the impact this virus has had on Siouxland. Thanks for joining us for this hour-long special edition of Siouxland News, COVID-19 A Year in Siouxland. Tonight, you'll hear from local health professionals on the front lines of the fight against COVID-19 and those working tirelessly on the vaccine rollout. We revisit local return-to-learn plans and the virus's impact on education, and we speak to local business leaders and how our local economy is recovering after virus restrictions. But we begin tonight with a look at how the pandemic evolved over the last year. Here's Siouxland News at Sunrise anchor Jacob Heller.
On December 31st, 2019, the World Health Organization received the first report of a viral pneumonia in Wuhan, China. Just 9 days later, an outbreak of a novel coronavirus, COVID-19, was confirmed. The first death of this new virus was reported January 11th, and just 20 days after WHO first learned of the virus, it appeared in the U.S. By February 3rd, the U.S. had declared a public health emergency. By March 11th, the WHO declared COVID-19 a global pandemic. President Trump declared a national emergency 2 days later.
I am officially declaring a national emergency.
On April 4th, 1 million cases were confirmed worldwide. Come the end of May, the United States had documented 100,000 deaths from COVID-19. Reached 2 million confirmed cases by June 10th. On August 17th, COVID-19 had become the third leading cause of death in the nation. September 28th brought a grim global milestone: 1 million lives lost.
These flags are indicative not only of the lives lost, but of the families left behind and suffering.
The world reached 40 million confirmed cases by October 19th. By mid-December, the FDA had approved the first 2 vaccines. On January 1st, 2021, the country reached 20 million confirmed cases. By the 10th, 90 million confirmed worldwide. Just 5 days later, 2 million people were dead.
We're now on track to have enough vaccine supply for every adult in America by the end of May.
By March, millions had been vaccinated, and a third vaccine option was approved for use 1 year after COVID-19 was declared a national emergency.